At Northern Light Eastern Maine Medical Center, your entire care team is dedicated to making healthcare work for you. One of our commitments to you is making sure you have all the information you need to successfully continue your recovery from heart surgery at home. We know that you may have questions after your surgery. This video will explain what you need to know to care for yourself when you get home. When you get home from the hospital, your body will still need time for recovery. These are some symptoms you may experience after cardiac surgery. Lower rib pain, aches between your shoulder blades and elbows, pins and needles feeling around the incision in your sternum or in your leg, if a vein was removed from your leg. Mood swings, feeling down or blue, vivid dreams, short-term memory difficulties or forgetfulness, food tasting like metal or sawdust, hot and cold flashes or night sweats. Please take your temperature and notify your surgeon or nurse care coordinator if you have a fever. Feeling cold all the time or in waves. Hearing your heart beating in your head or feeling your heart beating in your chest. Extra swelling in the leg where the vein was removed if you had a coronary artery bypass graft or bypass surgery. Some shortness of breath when moving about or walking. Most of these symptoms will start to subside after the first or second week. You may experience some, all, or none of these symptoms. Use acetaminophen or Tylenol as instructed on your discharge medication list. It's very helpful and will allow you to rest better and feel more comfortable. Tylenol should be taken on a scheduled basis. Visiting nurses are a very important part of your recovery. They will help you and your surgeon with the recovery process and will speak to your surgeon's office directly if there are any questions or problems. Recovery takes time. It's normal to feel tired up to 4 to 6 weeks after your surgery, but you should feel like you're making small improvements every day. Hand hygiene is one of the most important ways to prevent the spread of infection. Your care team washes their hands and uses hand sanitizer to keep you safe. For your safety, you are welcome to ask your caregivers to wash their hands at any time. If you're like most patients, you'll want to recover as quickly as possible after surgery. One way to recover faster is to follow the progressive walking program. This is the least amount of walking you should do each day. Your care team will explain the program to you and answer any questions you may have about walking. Please keep these tips in mind. Walk at a comfortable pace, but not to the point of exhaustion. You should be able to walk and talk at the same time. You may climb stairs. Do not sit for more than 1 hour at a time, and elevate your legs when you are sitting. Move your arms and shoulders to prevent stiff shoulder joints, but not to the point of overuse. You will also be referred to cardiac rehab. Cardiac rehab is a medically supervised program that helps improve the health and well-being of patients who have heart problems. Rehab programs help you with exercise training, education on heart-healthy living, counseling to reduce stress, and a return to active life. You may be able to participate in cardiac rehab after your follow-up appointment with your surgeon 3 to 4 weeks after surgery. An incentive spirometer is a medical device that will help keep your lungs clear, strengthen your breathing muscles, and help prevent complications such as pneumonia. You will receive a spirometer when you go home from the hospital. It is important to use the spirometer for at least 10 breaths 4 times a day. Continue using the incentive spirometer daily until your surgeon tells you it's okay to discontinue use. Monitoring the area near your sternum where you were cut open for surgery, also known as your incision, is an important part of your recovery. There are several things you can do to reduce the risk of infection. Wash your incisions twice daily with antibacterial soap and water. Do not apply ointments or creams to your incision. You should shower daily, but no baths in the tub for 3 weeks following surgery. It's not unusual for your incision to drain a small amount of clear or reddish fluid. Notify your surgeon if the drainage has a foul odor or becomes cloudy, thick, or yellow in color. If any areas of your incision open up, please let your surgeon or care coordinator know. To help your incision heal, please do not lift, push, or pull anything over 8 pounds. For example, a gallon of milk weighs about 8 pounds. Avoid activity that will pull on your chest, such as vacuuming, raking, shoveling, snowblowing, mowing, shooting a firearm, or splitting wood. If you were provided a bra during your hospital stay, you should wear it every day, 24 hours a day, until seen at your follow-up appointment with your surgeon. If you have any areas that chafe, undo the clasps in that area and cover with a soft, clean cloth. Medications are an important part of keeping your heart healthy after surgery. Your medications may be different than what you were taking before surgery. You should only take the medications prescribed to you when leaving the hospital. The surgical team will discuss your medications with you before you are discharged and again at your follow-up visit. A medication list and schedule will be given to you before you leave. You will receive a 1-week prescription for pain medications. If needed, additional pain medications can be obtained through your primary care provider. Please take your medications as instructed at the time of discharge. Some medications may only need to be taken for a short amount of time, while other medications may be for long-term use. Unless you are a diabetic, you may eat whatever you like the first month after surgery. Salt intake should be limited. After 1 month, follow a low-fat, low-cholesterol diet if you had bypass surgery. For guidelines and advice on preparing healthy meals, ask any member of your care team. Our staff will connect you with an expert who will work with you one-on-one to help you achieve the proper diet. It is important to drink at least some fluids every day. When you recover from surgery, you can count on your care team supporting you every step of the way. To monitor your progress, you'll receive follow-up phone calls from your nurse care coordinator. The nurse care coordinator will call you on the day you go home from the hospital, or on Monday if you're discharged from the hospital on the weekend. Your nurse coordinator will be in contact with you until your follow-up appointment with the surgeon. You may wish to keep a list of questions to ask your nurse coordinator during these calls. You'll have a follow-up visit with your cardiac surgeon in approximately 3 to 4 weeks. We will contact you about 1 week after discharge to schedule an appointment. Your primary care provider will be notified of your surgery and discharge from the hospital. Please make an appointment to see your primary care doctor within 7 to 10 days of going home from the hospital. And remember, you can always call your primary care provider with questions about your usual medical care. Finally, a cardiologist will follow up with you about 4 to 5 months after your surgery. Your cardiologist's office will connect with you to schedule this appointment. Earlier in the video, you learned about some of the common symptoms that you may notice after surgery. While these symptoms are normal, there are some symptoms that are not normal. Please notify your surgeon's office or care coordinator immediately if you experience chest discomfort other than incision pain, shortness of breath that does not go away with rest, shortness of breath that occurs suddenly at night or at rest, irregular changes in your heartbeat other than what is expected during exercise, extreme weakness, sweating, paleness, or fainting, pain not relieved by medication, yellow, cloudy drainage from your incision, or increased redness, swelling, or tenderness around the incision, any openings of the incision, a temperature of 101 degrees or more, a weight gain of more than 2 to 3 pounds in a 24-hour period or 5 pounds in 7 days, depression that does not go away and is interfering with your daily functioning, continued nausea and an inability to eat or drink. Again, if you experience any of these symptoms, please notify your surgeon's office or care coordinator right away. Our goal is to exceed your expectations during your entire visit and make healthcare work for you. Your feedback will help us provide the best possible care to all our patients, including you and your family. Several days after your visit, you may receive a survey in the mail from our partner Press Ganey with questions about your experience. This survey is confidential. Thank you in advance for taking a few minutes to answer the questions and return the survey in the postage-paid, self-addressed stamped envelope. We appreciate your feedback. Thank you for choosing Northern Light Eastern May Medical Center for your care. We hope this video will prepare you for going home and help you understand what you can expect. If you have any questions, don't hesitate to ask your surgeon or a member of your care team at any time. Best wishes for a full recovery and a return to good health.